Hello, everyone. Thank you so much for joining us for Health Professions Week Health Talk. My name is Dr. Kameron Matthews, and I'm a family physician with the Veterans Health Administration, and I am joined by two very good friends of mine. I would like them to introduce themselves. Dr. Ortega, please introduce yourself.
Hi, Cameron. Thank you for having me. I am Gezzer Ortega, and I am physician scientist, and I'm lead faculty for research and innovation for equitable surgical care at the Center for Surgery and Public Health at Brigham and Women's Hospital at Harvard Medical School.
And Dr. Brown.
Hey, what's up, everybody? I'm Dr. Italo Brown, emergency physician, clinical assistant professor at Stanford, and social justice and health equity curriculum lead at the School of Medicine at Stanford.
Great. You both have such impressive backgrounds, and I think, first of all, we all know each other through the Tour for Diversity in Medicine, and we clearly want to be advocates and kind of, I would say promote maybe kind of larger justice issues within medicine. I think that kind of comes naturally to each of us. I was hoping you guys could share what it means to you to be an advocate. We're all physicians. We all clearly have a passion for helping our patients, that we wouldn't do what we do in the times that we are, right, if we didn't have that level of passion. But I feel like we take it to that extra level. And so I was hoping you could share, what does advocacy mean to you kind of in your daily life, but then maybe just throughout your career as well too. Dr. Ortega, why don't you start off?
Sure. And so for me, I think it's a little bit about what my director always stresses to me and tells us is, do what keeps you up at night. And I think that sometimes there are things that we see our patients that are either working through or dealing with in their communities. And through the work that I do, through the research, I try to investigate some of these problems, try to identify them, and then figure out what interventions can help them, and serve as an advocate on the inside for my patients and for their communities. It's fortunate that I look like them and come from the communities that they come. And so that helps a lot because I understand. And so speaking up and on the other side, as they say, sometimes is important.
Completely. I think you're answering the questions that we need to have answered, right? On a kind of academic research level. There's so much that we don't know in medicine, and you're answering those questions, but you're doing so with your community in mind. And that's the ultimate form of advocacy, right? Dr. Brown, what do you do in your day-to-day, or maybe not day-to-day, but how do you see advocacy playing out in your world?
I mean, first off, I think that it's important for us to note that once you become a physician, it's almost like part of that pledge to advocate effectively for patients. Sometimes that means you're advocating for their best care within the medical system. Sometimes that means that you're coming to bat for them, or you're giving insight for what the experience is like to other people who might be distanced from it. So, I mean, I take a lot of pride in doing that. As an ER physician, I mean, we're always advocating for patients, not just to be given better care, but also if they need non-medical needs, if they have non-medical needs that need to be met. So able to understand these different things that affect their lives and their ability to attain health. With that said, I mean, outside of that, everything to me is about community engagement and being able to be a representative of that particular community that I'm embedded in or that I've come from at all levels, whether we're talking about inside a clinical setting or an administrative setting, or if it's just about advocating through policy for resources for these community members. That to me is like the passion. That's where it comes from. It's because I've been there and I've wanted somebody to be a voice for the voiceless. So we kind of fill in that slot. That's, essentially what it means to me to advocate.
How are you doing that in the community? What do you do? Are you working with any organizations in particular?
Yeah, I mean, so at a large level, I think that it's important to note, like, there, SNMA, Tour for Diversity, these are organizations that advocate on behalf of people who are typically disenfranchised or marginalized. With trap medicine, we advocate more specifically for community members, whether they've had access to healthcare consistently or if they have certain distrust of the healthcare system. We try to serve as that liaison. And personally, I've always thought about using my platform to advocate for the health of people of color. We see the outcomes. We understand that there's different health disparities that affect us. And so if I'm able to be that translator, that conduit for the communication using my platform, I think of it as a job that I'm so happy to take. And it literally keeps me, like he said, it's the thing that keeps me up at night. It's the thing that keeps me going.
Completely. I think for myself, my advocacy has morphed over time, right? I initially thought that I wanted to go a little bit more probably bread and butter through our training, which was, it's actually your other degree as well too, Dr. Brown, but as far as going into public health, right? I going through training, I didn't really have a sense of how I could figure out how to advocate for more than just like that one patient in my exam room, right? And so I thought it was going to be in some way doing public health work, which is necessary, right? We've seen that through the pandemic. We know that we have some significant weaknesses, right, in our public health infrastructure, and it's necessary. But for me, then it morphed my interest in the law, right? I happen to be an attorney as well. My interest then became, okay, but if we're helping in the public health sphere, we also need to understand the government and legal structures in which we practice medicine, which is oftentimes very limiting, right? It sometimes is a reason why we can't help a certain patient or a certain community, right? And I wanted to be able to understand that. Then it morphed again, like, yes, I like policy, I like law, but then I realized I actually like running hospitals. I actually like the operational side of healthcare because I'm making policy that affects everyone walking through that door. Yes, I can help them, I can treat them, I can be their advocate one-on-one, but if I'm not countering maybe the business people that are making decisions, the finance people that are making decisions, the insurance companies that are making decisions, if I don't know how to answer the many questions and unfortunately the many bad decisions that they make that aren't truly in the best interest of our patients, then I feel like that was a pretty major gap. So that's actually where I see my role right now in Veterans Health Administration, that I'm an advocate because I am keeping this health system truly focused on the patient, on the veteran, as opposed to the bottom line, which we differ from private sector anyway, but it's not about keeping this health system alive. It's about making sure that every veteran that enters is achieving the highest level of healthcare possible. And that to me is ultimately the best form of advocacy. And I feel like I can only do that as a physician because, again, I'm countering all of those other kind of incentives in the system. I don't know, that's how I see it. Dr. Ortega, how do you, though, like, I see it every day. There's so many questions. There's so many unknowns that we have in our field, right? Medicine it's a science, right? But it's also an art, right? And we also know we're practicing sometimes really an imperfect art. How do you decide, what you're researching, what questions, what you're investigating? Do you have some sort of interaction with your patients that then set you off down a path, or how do you decide what angle you're going to take and advocate for?
Yeah, Dr. Matthews, I think a lot of it stems from what you said. You have to put the patient first, and you also have to, I think we're all scientists, right? We all recognize patterns and we all see certain things that after a while, just treating patients and doing your best to care for them, you say, okay, well, there's a couple of things that I recognize that just keep coming up. And you start to think to yourself, well, what can we do to avoid this? What can we do to prevent this, right? Or what can we do to make this a little bit better? And so those become your research questions, right? Those become the questions that just fuel you to kind of figure out, okay, how am I going to make this a little bit better? And I think for me, it also comes from like a diverse training background. I think one of the cool things about medicine is that people have so many different backgrounds, whether it be like in technology and finance. I have colleagues who are artists and bring music and art to try to, solve and help and heal patients. I have individuals who have strong tech backgrounds and are involved in technology and use that in their research. So I think it's a little bit of like what you feel you can bring to the table, right? What's your unique perspective?
Mhm.
And that diversity, right, is what makes it really rich. It makes it interesting, but also moves the field forward, right? Just kind of like having a diverse perspective to try to solve a problem, right? Because these are complex solutions that take really, really talented individuals with really creative ideas to figure them out. And then you also keep a little black book with you, so you can write down your ideas. And then when you're ready to have one of them, then you just, okay, I got another idea. So,
There we go.
but you
Creativity
work on
flow.
it. Yeah, that's it.
Exactly. Exactly. I mean, do you find that you're able to, because this was one of the reasons I purposefully steered away from research, but I completely acknowledge all of the space that the three of us fill is all necessary, and they all clearly intersect, right? But do you ever get to implement any of your work? Like, have you gotten to that point where you answered a question, you I don't know, got some data in some way, and it gave you that evidence? Now I can do this. Have you been able to connect those dots personally?
Yeah, no, and that's a very rewarding feeling. I mean, we've within the work that I'm doing currently, we've developed a curriculum for surgical residents that focuses on cultural dexterity. And so teaching our residents how to have cross-cultural encounters. We believe that it's a skill that can be developed and one that takes practice and training. And so we've been able to implement that at 8 academic medical centers across the country. And we've rolled out the first phase, and now we're in the second phase of it. And it's rewarding, right, to see that in practice, to see residents use it. And it always feels good to have a resident email you or give you a text and say, you know what, I did your curriculum, I use this, and it really helped a lot. Right? Like,
Oh, that's so
and
good.
it's always like when you see that light bulb go off, and it's the same light bulb that goes off in a student, right? When you know that they got it, right? That they figured it out. And so it's a great feeling. But more importantly, it helped that patient, right? Like at the end of the day, that encounter was now improved because of that, our work in the research.
Exactly. Exactly. Dr. Brown, I know you really consider mentoring to be equally as important in your career as well. Do you feel like you advocate for your students, for your trainees on a regular basis in the work that you do?
Oh yeah. So I mean, first, I think a mentor, a really good mentor, is an advocate. They're not only someone who's familiar with the work that you do, but they are willing to stick their neck out to help you advance. And that is, like, to me, the hallmark feature of having a very, very good mentor. And so I strive for that when I have identified students who are in need of mentorship and who have clear mentorship, who have clear goals that they're trying to attain. I think that my job is to leverage knowledge of the system and my network, and maybe even bringing them on board for different opportunities and vetting opportunities, or helping them vet opportunities. That, to me, is a process of advocating for someone, because at the end of the day, like, there's no clear blueprint to do this stuff. And so sometimes you need an individual who has special knowledge, skill sets, who has abilities to kind of help sift through that and develop your individual lens. So that's a role that I've taken a lot of pride in. And I know that for most of the students that I've worked with, they feel something, and then there's a kind of a back end ask, which is, propagate this, pay this forward. So you have to turn around and advocate for someone else. It doesn't have to be another medical student. It can be somebody who just is not in a position to be able to leverage everything at once. So as long as I, do my job, I think they end up doing their job, and it just keeps the cycle going.
Perfect. Perfect. I mean,
Mm.
I feel just as equally as enriched with those relationships. I feel like I'm helping them as much as they are helping me. I feel like I learn a great deal. So I love what you said. A mentor is an advocate. I think that's so critical. I think being a physician, I think ingrained in our role, in our responsibility is that we're advocating for individuals, communities, and maybe even at times, like I said, in my role, I'm advocating for a population, a nation of individuals that need
Right.
some level of care. And I feel honored to do it. I know you guys do as well too, that we strive for so long to get into these roles, and it's just so fulfilling on a daily basis, right?
I agree. There was one thing I had to learn was how to advocate better for myself.
Oh.
I think that it's sometimes easy to see and parrot the way that other people practice advocacy without turning inward and really saying like, how do I advocate for myself? How do I do this in a way that is both comfortable and honors my core values and honors the people who've invested in me? So always like looking for both sides, seeing like, okay, I'm going to leverage my knowledge to help other people, but when there is an opportunity that I think that is fit for me and I can actually do it and I'm passionate about it, how do I best advocate for myself? And that's come from, again, watching mentors, watching friends, watching people who are dedicated to this type of work, seeing how they move, and then taking, a page out of their books.
Dr. Brown, you like kind of hit it right on the, as they say, hit the nail right on the head. And that was something I was going to say, is that advocacy comes in so many different forms. And like you mentioned, like self-advocacy, and I was going to talk about even advocating for your peers, right? Because you mentioned advocating for your mentees. And I think that that's also important, right? And when we think about our current environment and the system that we're in, right? Like, all the things that, our peers sometimes who may not be as fortunate to have, a resource rich environment that they work in, or an environment where they may be more biased, or, more structural issues that are impending their success. Like, how do we advocate for them, right? How do we support each other? And so, there are plenty of opportunities to advocate. And I think, you just have to figure out, what are your, who you are and what are the things that are important for you, so that you can make sure that you advocate for those for yourself and as well as for others.
I love it. I love it. Well, gentlemen, I applaud you on a daily basis. I absolutely have adored knowing you personally all these years, and am honored to continue to work alongside you as we all are doing what we can to help our patients, and to really be strong advocates on a daily basis for any number of people. I'd like to thank all the viewers out there. Thank you for just taking a few minutes to listen to us chat it up as friends and as colleagues. Please follow us on social media. We're Tor for Diversity in Medicine, and that's at Tor for Diversity, the number 4. Thanks so much for joining us. Bye-bye.